So at Aljoya, we're very proud of our unique and special relationship we've shared with the University of Washington School of Nursing for the past 30 years. Through our ongoing collaboration, we have developed evidence-based programs such as our Thrive program, which directly benefit our residents. If you would like to hear more about this special partnership, I'll be happy to talk to you about it after today's program. And now we are all ready, and I'm delighted to introduce our presenter. Barbara Cochrane is a professor at University of Washington School of Nursing, and she will discuss the normal biological changes at aging and consideration for aging well. Usually we would have this presentation here in our theater, but we're doing it via Zoom, and we thank you, Barbara, for joining us and giving this presentation. There's a lot of interest from it, and we want you to please take over now and take it from here.
Thank you. Let me just get this set up. And hello, everyone. I'm so honored by the invitation to talk with you today about living wisely with physical change. And I've subtitled this Aging from the Inside Out, in part because when I teach the biology of aging to students at the University of Washington, I used to have Reba de Tornyay, who was a former dean, endowed the professorship that I hold, and just a dear friend and a strong advocate for aging. She would give the final lecture in my course, and she called it Aging from the Inside Out. In other words, the students had learned all about these physical, biological changing, and now she was going to give them the true experience. So I know you're all living with aging and changes, and you probably could give this talk just as well as anyone else. I hope there's some new information for you. What we're going to cover today are physical changes inside and out, with a focus on what's normal and biological. But I'm also going to talk about common age-related physical health changes, and you'll hear me make that distinction several times. By age-related, I mean those physical changes that we experience simply because we've lived a long time. We've had all kinds of exposure to things. We've had health habits that have affected our physical health and the changes. And we have potentially had injuries that have also affected our physical health. So those kinds of changes are related to age because they happen over time, but they're really not sort of normal biological changes. And then I'm going to finish up with a little bit about living wisely. I think understanding the difference between biological normal changes and age-related is part of that living wisely, but also health promotion. And I just thought I'd start off with a nice cheery cherry blossom scene from the University of Washington to put us in the appropriate framework for thinking about health promotion. Please feel free to, if you have questions, put them in the chat box, and I will try to get to them as I go along. I'll stop a couple of times to give you a chance if you have some questions that are brewing, and we'll move along. What is normal aging? When I talk about normal biological aging, those are the changes that occur as a result of all kinds of biological processes, genetic processes in our body, but are not necessarily the same thing as age-related. Things that are age-related are things like heart disease and cancer. We all know that the risk of heart disease and cancer increases with age, but it's not necessarily, those are not necessarily things that happen to everyone. Normal aging, normal biological aging begins when we're conceived, and it continues throughout our lives. Normal aging is viewed as universal. In other words, it happens to everybody, not just most everybody. It's inevitable, it's progressive, and I would want to caution that it's not always bad. Although this is a talk on physical changes, there are a lot of both physical and particularly kind of mental health related changes that occur as we get older that are wonderful for us, for society, and to move our lives along in a wonderful path. Wisdom is a great thing, experience, perspective. Those are some of the changes that we experience as we get older that I think are important, and they're good changes. Another thing to keep in mind is that older adults are very diverse. I often remind my students that whatever stereotypes they might have about people as they get older, they're usually wrong. Older adults are just as diverse as younger adults. And when you think about it, healthy aging starts really at the beginning of life. So the older adults today are really the survivors. They're the healthy ones, and it's to be celebrated. Another thing to keep in mind is that health at older age varies, and poor health is not necessarily inevitable. So I'm going to sort of march through some of the various biological systems of our body and talk about what are the normal changes with a little bit of information about the age-related changes that happen to many older adults, but not all. As we age, normally the blood flow around our heart, what's called coronary artery blood flow, decreases. It gets a little bit slower. There are changes in the pacemaker cells that prompt the electrical activity in our heart. And so with a slight decrease in pacemaker cells, there may be differences and changes in the electrical conduction. Maybe some of you are experiencing some of those kinds of changes with different heart rhythms. The heart can become a little bit less effective at pumping because the heart muscle thickens, the valves and the arteries stiffen a bit. However, it's important to keep in mind that these normal biological changes really have only a minimal effect on our heart function at rest. Where those changes become important for us is when we are stressed, when we're much more active. That's where we might see a little bit of a challenge because our reserve capacity is somewhat limited as we get older. For our blood vessels, you may have heard about atherosclerosis, or those plaques that might form in blood vessels. There is some formation with some progressive hardening of the arteries, although those kinds of changes are not as much biological, even though they happen in everyone. They are increased much more so in people based on their lifestyle, the health habits that they follow. Blood vessels are also less elastic. In other words, they're stiffer. And so we see sometimes a very slight increase in blood pressure. Again, that slight increase doesn't usually have a major impact on a person's health unless their body is stressed in other ways or if they have other kinds of health problems. So some age-related health conditions that older adults may experience because they've just lived so long, they've survived so long, are things like hypertension or high blood pressure, or orthostatic hypotension. In other words, low blood pressure when you stand up. Have you had that experience where you suddenly stand up too fast and you start feeling a little bit dizzy? That happens because blood pressure will fall, kind of flow from the head, and it takes a little bit of time, sometimes for our bodies to readjust for the blood to return back from the lower legs. And it's one of the reasons why you may have had your healthcare provider or someone say, don't stand up so quickly, take your time. That's known as orthostatic hypotension. In terms of our lungs, there is some changes in the normal structures that help us keep our airways clear. So there is some decreased airway clearance, and people are more at risk for things potentially going down into the lungs, and coughing. The hair cells that are supposed to keep moving mucus back up are not as plentiful or as effective. In addition, lung capacity, the amount of air that the lungs can hold, decreases a bit. It's up to 40% by age 70. And our lungs become less elastic, stiffer. The air spaces in our lungs enlarge. And so we see in older adults a bit more air trapping and what's known as residual volume. In other words, if you've ever had one of those tests where the doctor has you breathe in and out and try to blow as much air out as you can, they can measure your residual volume of air, and sometimes older adults have much more residual volume, which means that that air is not exchanging with oxygen as well, and that decreased oxygen means that the oxygen getting to the other parts of your body is diminished. And that all relates to this idea that some of these age-related changes can affect us more when we overexert, when we're stressed, than when we're at rest. We don't notice them as much. Some age-related changes then that we see because people have lived a long time, but it's not necessarily to be expected, is emphysema or COPD, bronchitis, as well as maybe an increased risk of infection. And I'll get into that a bit later on. But related to the lungs, it's because of that decreased airway clearance that we're not getting sort of the bad air and the mucus out as easily as we have maybe in the past. And I should mention, I say we, because particularly with all of this COVID advisories going out, I've realized that at 67, I'm now in a high-risk group, and celebrate my older age, and was pretty excited a couple of years ago to sign up for Medicare. And all of this information is particularly meaningful for me and my parents at this point. So the immune system, I mentioned that older adults are potentially more at risk for infection. The efficiency of the immune system declines to some varying degrees based on a person's health and lifestyle in general. The non-specific defenses that I mentioned, like those hair cells that beat mucus back up out of the lungs, cough reflex, that kind of thing, seem to be less effective. Some other non-specific defenses that we have against infection are skin. And you may have noticed that you have decreased sort of subcutaneous fat, so your skin is thinner, which means that it's presenting less of a defense to injury, to cuts, and things that might get in to cause infection. There's also seems to be a decreased ability to make antibodies in response to the bugs that you might be exposed to in life. But the age-related changes are the ones that we're most concerned about, because with those sort of non-specific defenses, if there are other health concerns going on, common infections can be much more severe. A person can have a slower recovery. They might have a decreased chance of developing adequate immunity. You may have heard that we're not really sure to what extent people who develop COVID will actually be immune afterwards. Another thing to keep in mind is that autoimmune disorders can increase. Cancer is an autoimmune disorder. That's an age-related change. but it is one that we see more often in older adults. And for all of these reasons, you hear a lot about the importance of vaccines. Your flu vaccine, pneumonia, shingles. Even when there's not a pandemic, we're talking about a lot about and encouraging folks to get their vaccines. Some of the neurological changes of aging that we see is that the brain decreases a bit in size and weight. Those cavities, they're known as ventricles in the brain. They're sort of spaces in the brain. They increase, and in part because there's fewer neurons and the neurotransmitter that sends signals throughout the brain, those levels are decreased. We also see more deposits in what's known as neurofibrillary tangles in the brain. Those kinds of deposits and tangles, if they increase to a great extent, are thought to be related to dementia and particularly Alzheimer's disease. Some of those changes are normal. In excess, it's not normal. When I talk with students, I try to emphasize with them that dementia is not an inevitable change of aging. People worry about that a lot. And so I point out the fact that a type of intelligence known as crystallized intelligence is pretty resistant to aging. You maintain crystallized intelligence throughout life and into your older years. And crystallized intelligence is things like knowing the meaning of words, remembering professional facts, remembering your past, your years of growing up, habits that you've been able to, or skills that you've been able to acquire over time. That's known as crystallized intelligence. We don't see a lot of change in that with aging. We do see, as people get older, some changes in fluid intelligence, and you may have some experience with that. It's things like doing calculations, reacting quickly, being able to learn new tasks and put things together in new and different ways. That does have some decline, but it is not, a devastating decline. There are usually ways to accommodate those changes in fluid intelligence. Remembering to remember. I'm wondering how many of you use Post-it notes, which I use a lot, to keep myself remembering things that I need to do. That's part of the fluid intelligence that we do see change a little bit, but the crystallized intelligence is pretty resistant. Some of the age-related changes that we see in terms of our neurological or nervous systems, these are things that don't happen to everyone, but we do see them more in older adults. And why would we want to know some of these things? Because we don't really have a lot of cures right now. But the idea is that early diagnosis of even Alzheimer's disease is helpful, because there are some things that can be done to decrease the symptoms of Alzheimer's and Parkinson's. Stroke can be prevented for many people, but it also, by early diagnosis, helps you and your family have the important discussions about what you want your life to be like and how you want things to be handled should some of the devastating effects of these disease actually take place. Those are age-related, though they're not going to happen to everyone. And so one of the things that I emphasize with our students as well as with older adults is that sudden changes in cognition does not necessarily mean, oh, it's Alzheimer's and dementia, and so nothing can be done, because there's a cognitive change known as delirium that comes about when a person has been exposed to certain toxins, or perhaps drug effects, or other disease processes that are incredibly treatable. And so it's important to know that age-related changes can be addressed. So sensory changes, I think, is one of the areas that we all see some effects. In fact, it's interesting because my 43-year-old son is now experiencing the age-related sensory changes. With our vision, this is known as presbyopia. The lens of our eyes thickens. It gets a little bit yellowish, and you may have noticed that. If it gets to be fairly profound, severe, then that means a cataract is formed, and you might, your provider may recommend cataract surgery, but even cataracts are age-related. It's not something that you should necessarily expect that happens to everyone, and so you'll want to point it out to your healthcare provider when you have these changes and continue to have your eye exams. Other things that we see is some decreased contrast sensitivity, so maybe not picking out the differences in colors if they're not distinct enough, and then some delayed recovery from glare. So driving at night, you might notice the glare a lot more, as well as moving from light to dark. These are biological aging changes, but they shouldn't be so severe that you can't adjust or accommodate to them. For hearing, the age-related changes are known as presbycusis. You're getting the idea. Presby kind of refers to older. But some of those changes that we see in everyone is a little bit of a gradual loss of hair cells, and the hair cells are the things that kind of give our brains cues to the frequency of sounds and what's being said. And so with that gradual loss of hair cells, we do see a little bit of a loss of high frequency sounds and some difficulty with speech discrimination. When I train folks in research projects to interview older adults, particularly with the women, I really emphasize that if you're working with someone who has some hearing difficulties, that the strategy is not to talk louder, because when women talk louder, the frequency of their voice goes even higher, which makes it even harder. So the great idea would be to talk lower so a person can hear you better. We've heard a lot about smell recently because of COVID, that one of the early signs in some people is a decreased sense of smell. Older adults in particularly have changes in smell either temporarily or on an ongoing basis. And to some extent, that's normal, although a really profound decrease in smell is not. And I do want to mention, people are thinking that the sense of taste also decreases, but really the reason that our sense of taste might change as we get older is because taste is so strongly tied to our sense of smell. If you think about it, it's, eating is not as enjoyable if you can't also smell the food. So those are just some common changes of aging, but they're not profound. It's not like you're going to lose your sense of smell unless there's something else going on. And so it's important to point out to your healthcare provider if you have lost your sense of smell. Touch and balance can also change. And so sometimes our ability to sense things in our periphery, our hands, our feet, decreases. The discrimination between different touches can decline slightly. That's normal, but it's not so much so that it should be painful, numb, or unable to make that kind of discrimination. There is also some slowed reaction time. For example, pulling away from painful stimuli might be slowed, and so it's important to keep your environment, be aware of your environment. And there are some vestibular changes that can occur. Vestibular refers to our sense of balance and how we adjust to it. And so, as I'll talk a little bit about in a minute, that's really important to keep in mind and accommodate, because it can increase our risk of falls. But those slight changes don't translate to person's going to fall, a person can't walk anymore. Those are more functional changes that we see in some older adults, but not all. Do you have any? I don't see any chat questions, but I'm going to stop here and see if any questions have occurred to you about some of these kinds of changes, or even if I haven't been very clear, maybe I've been clear as mud, about how I look at the difference between normal biological changing and age-related changes. Those age-related changes are important to know about, because otherwise we see a lot of times folks who think, oh, it's just a normal part of aging, and so I'm not going to mention it to my healthcare provider, when there's actually things that can be done to help.
Is the presbyopia, does that have anything to do with your vision for long distance being not as good as before?
It can. It certainly affects your ability to accommodate to long distance and close up, changes in close up and depth perception and that sort of thing. And again, those kinds of changes in combination with other changes can increase risk of falls. For example, if you're out and about and walking in an area with some really uneven pavement and some difficult or problematic shading, so that the light dark issue as well as the depth perception issue is playing into things, then you have the slight vestibular or balance changes that can be a real concern. So that's an excellent, excellent question. Okay, let's see. If a family member or friend tells you about your vision or hearing, how should you recommend an answer? That's a great question, because I know we all deal with family members and friends giving us lots of advice and having a lot of opinions about things. And the key thing is to know what's normal for you, what are the health issues that you're dealing with, and to get those kinds of things checked out. And so if they are telling you that maybe you're talking too loud, you might say, I should get that checked out to see if there's been any changes in my hearing. But it's also possible that they are offering advice from things that they've heard, and those kinds of things aren't necessarily true for all people. I hope that answers your question. So let's take a look at some gastrointestinal changes of aging. And I think of the gastrointestinal system as going from the mouth all the way through the intestines. So we see in the mouth a little bit of dryness, a little bit of gum recession, but major dryness in the mouth, a lot of gum recession in which we start losing teeth or needing dentures or implants. Are not normal changes of aging. Sometimes the dryness is drug related, but those are things that you would want to talk with your healthcare provider or your dentist about. There's a lot of things that can be done. In fact, the most gratifying sort of advance in dentistry is that it is no longer anticipated or expected that people get dentures later in life. All stops are pulled in order to be able to preserve teeth, because having functional good teeth means healthy nutrition and other kinds of efforts going forward. And in particular, thinking about being able to chew effectively and get food down through our throat means that we are potentially at less risk for having swallowing problems. And we see a lot more swallowing problems in folks who have a lot of changes in their teeth or problems with dentures. And the issue with swallowing problems is you run the risk of sometimes food going down into the lungs and then jeopardizing lung function. The esophagus, which is that tube that goes from your mouth down to your stomach, does have some decline in sphincter function. Sphincter is sort of those muscles that keep food from going up and help you to open up those sphincters so that food can go down in the right place. There is some stiffening of the wall. And so one of those age-related changes that we see, not in all older adults, but in a larger number, is GERD and gastroesophageal reflux disorder, heartburn, those kinds of things. Not to be expected, so let your healthcare provider know if you're having those issues, but we do see it more commonly in older adults. In our stomach, there's a decreased motility. In other words, it's not as active. And so food may stay around a little bit longer, which means that you might not be hungry. It might affect your feeling of being full for a much longer period of time. There's also decreased protection of the membrane or the mucosa around the inside of the stomach. And so although that cellular protection is decreased, there are other things that might happen to make a person more at risk for things like gastric ulcers, discomfort, that kind of thing. Again, those are age-related, but they can happen if this sort of normal change, which is changes in the cells that protect the mucosa, are combined with other kinds of problems. Interestingly enough, because we hear a lot about constipation as well as some issues with diarrhea in older adults, the intestines don't change as much as you think they might. There are some changes in decreased motility, in other words, that movement of food through, but what really profoundly can affect diarrhea and constipation are medications and diet. And so those are things to think about, to talk with a healthcare provider about, a nutritionist, if you are experiencing some of those kinds of problems. So changes in the bladder and such, we see more involuntary contractions of the bladder, which means you may have different sensations, feelings like urgency, maybe some incontinence where you're leaking urine. There's also sometimes incomplete emptying, so it seems like you can never fully empty your bladder. And one of the reasons for that is that the urethra, which is this area, this sort of tube that comes out from the bladder, the lining is a little bit thinner, it's a little bit weakened, and the sphincter around it works ineffectively. And so we have problems with our bladder sort of sometimes being overactive, some issues with incontinence, but those are all things that can be treated. The physical changes are there, but the result of retaining fluid or having leaking of urine is not a normal change of aging, and you should talk with your healthcare provider about it. There are things that can be done, things that should be investigated. And then, as you know, the kidneys empty into the bladder. So just to know that there's some wasting away or atrophy of the vessels to the kidney, which means that the kidneys decrease a little bit in size. The blood perfusion to the kidneys, or what's known as are the renal organs, the blood perfusion decreases. And so the kidneys don't filter the blood into urine quite as effectively. Key consideration for this slight changes is that medications then can act differently as an older adult than when you were younger. And older adults are usually much more sensitive to medications because the kidney as well as the liver don't necessarily metabolize or break down things as effectively as they did in the past. but those are things that can be addressed, and so mention them to your healthcare provider. There are also some genitourinary changes, as I mentioned, that are age-related. Urinary incontinence is a big one. It is not a typical change of aging. It does affect women more than men until about age 80, but it also affects men a great deal as well. And one of the hidden consequences of us expecting a urinary incontinence or leaking of urine to be normal is that you end up managing it yourself. It can be expensive, buying pads and dealing with trying to change clothes. It can be embarrassing. So being able to have a healthcare provider who can help evaluate it and see what's going on, and if there are things that can be done to treat it and prevent it is very important. Older adults are also more susceptible to urinary tract infections, but it is not to be expected. What is interesting is that urinary tract infections, because infection can have a whole body system response, we sometimes see what's known as an atypical presentation. So kind of a common or famous scenario that we might see is an older person comes in and they're slightly confused and they don't have a fever. So just some vague confusion, not a lot of fever or no fever at all. And so people start working them up and trying to figure out if this is a change of dementia, when it actually, so that's the reason why I have the big iceberg here, is because there's all kinds of things happening when something like a urinary tract infection can occur. And one of the things is that our bodies react to infection differently. So we might not have as much of a fever response, and the response can affect our cognition temporarily. And so just checking for a urinary tract infection and treating that can sometimes resolve a whole host of other things. We do see in older adults and older men more problems with erectile dysfunction. This can relate to some of the changes that we see in the prostate gland and the sphincters and the urethras. And this is not something that is necessarily to be expected in an older adult, and it is treatable. And so this is something that should be evaluated. It's perhaps a sensitive topic to discuss, but an important one. Dyspareunia refers to having pain during intercourse. Often that can be related to the fact that when women get older and they stop producing as much estrogen, there's a thinning of the vaginal wall and somewhat of a wasting away. And so it's not as lubricated. And so there can be more pain with intercourse, but this also can be treated. And so please, if you remember anything, remember that these kinds of concerns should be brought up to your healthcare provider because there's things that can be done to help. I'm going to take a look at some questions here. Does adequate higher fluid intake help keep kidney and kidney vessel functions healthier? It is certainly, that's a great question and a wonderful suggestion. It is really important to stay hydrated because it does keep kidney function healthier. Actually, keeping the whole body hydrated is important, but it also helps wash toxins out. It helps keep our circulation going, and it keeps our kidneys healthier, particularly if it's water, clear fluids and that sort of thing. Okay. I'm so glad you're chatting in questions. This is great. So the endocrine system, this is hormones and glands. There is a little bit of wasting away or atrophy of the glands in our body, but the changes that we see in as we get older are more in terms of the action of the hormones. And a big one is glucose, or that sugar, the metabolism, that our livers aren't as effective at addressing glucose and moving it into the tissues to create energy. We also see some changes in calcium metabolism. And then particularly for women, one of the big hormone changes that we see with aging is with reproduction, because women go through menopause and have decreased estrogen and other hormones. But these changes, in and of themselves, the normal changes, should not be affecting your health. It's just once a person's body is challenged, stressed, or has other kinds of health problems going on, that also having issues with glucose or calcium metabolism can be problematic. We also see some slight changes in adrenal function, those hormones that are secreted in response to stress. Relates to, we have decreased reserve capacity, and so it's important to take care of ourselves, get plenty of rest, not get too stressed out, take our time, so that we don't sort of diminish the reserve capacity that we have. Hair and nails is one of the common areas that we see, and that's pretty evident to everyone. Hair does become thinner. In men, it may recede. It actually may recede in women as well. And we see increased hair growth in the ears, in the nostrils, in the eyebrows for men, or in the chin and the lips for women. It can be more coarse hair. But we also see decreased body hair throughout. That can be related somewhat, particularly in like your toes. You might notice slightly decreased hair on your toes because of decreased circulation. And then graying of the hair just relates to a decrease in melanin. That's that sort of color pigment in our bodies. With our toenails, they become thicker. They're maybe a little bit more difficult to cut. They grow more slowly. They may have a slight yellowish color. The key thing is to take good care of your feet and inspect them regularly. Keep your nails trimmed, and stay active, because getting circulation through walking, through exercise, can help to keep the blood going to the periphery of the body, so that the toenails stay strong, your circulation stays strong. And there's also things that can be done for keeping, if you're concerned about your hair, nothing really medically, but there are certainly strategies that you can explore for addressing the changes that you see in your hair. Skin changes with aging is another area that we see frequently. There is reduced glandular activity. In other words, our skin is drier, might be a little bit more scaly. I mentioned that there's less subcutaneous fat and cushioning, which then means that there's less of a barrier to injury, to assaults, that can happen, and that if you are putting on topical medications, they can actually get absorbed much more quickly, and so you want to be careful about that. If you've been using some sort of topical medications for years, know that as you start losing subcutaneous fat, there's less of a barrier to them actually being absorbed in the body. There's decreased elasticity, so the skin is thinning, it's wrinkling, it's maybe sagging a bit, although you see that more with exposure to the sun. But the skin is more fragile, and so injuries and infections are more common, and we do sometimes see easy bruising because of that thinning, as well as even more profound bruising if a person has age-related changes in terms of blood thinning. An important thing to point out is that only about 15% of skin aging is intrinsic. In other words, normal, biological. The rest is what's known as extrinsic. It relates to what we've exposed ourselves to as we've grown up. How much sun? Have you been using sunscreen? That's the bulk of the skin changes that we see. And this is just an illustration of identical twin sisters who were raised apart. Guess which one grew up in a very sunny climate with less use potentially of sunscreens versus a person who grew up in a less sunny climate where they weren't exposed to the sun as much. My mother and I grew up in Alaska, and although we dealt with a lot of limitations when we were growing up in terms of things getting to the state in a timely manner. You know, we didn't have live television for years and years and years. But one of the advantages was that we also weren't as exposed to the sun. And my mom's skin is much better than her sisters who grew up here in Seattle. So muscle and bone changes is another physical change that we see. There are both normal biological changes as well as age-related changes because of a lifetime of use and disuse. Normally, we do see a decrease in muscle mass. This is known as sarcopenia. In other words, the muscles sort of decrease in their strength, endurance, that sort of thing. However, decreased strength and sarcopenia does not have to be profound. And in fact, exercise throughout life, as well as even in your older adult years, can sort of decrease the speed with which that decrease in muscle mass occurs. Tendons and joints stiffen up. You may have already experienced some of those changes. We hear a lot about osteoarthritis, which is that problems with stiff joints that become painful and sometimes might lead to needing a knee replacement, that sort of thing. Osteoarthritis is not a normal change of aging. It just happens more. We see it more often in older adults because they've been through a lifetime of putting strain on their joints. But the sort of cushioning, the activity of bones and joints don't necessarily have as much of an effect on function and pain as the sort of exposures and injuries that we've been through in life. So if you're having pain, if you're having stiffness that's limiting your mobility, be sure and see your health provider because this is something that can be addressed. Another common change that we see in older adults, it's age-related, is osteoporosis. But there is some normal decline in bone density. It occurs in all older adults, and we see maybe by age 70, some slight loss of height as we are getting older. But osteoporosis, that's sort of what's sometimes called brittle bones, is not a normal change of aging. It is age-related. And unfortunately, we do see it more often in older adults, which can increase a risk of having broken bones than when someone falls or strains their musculoskeletal system. And I want to talk about why talking about function is so important, like our musculoskeletal system and our bones and our joints. And that's because understanding how our function is being affected can help us to plan ahead for services and supports. Maybe it might mean just setting up some accommodations in your home to keep things safe, such as bars to hold on to, keeping cords, keeping loose rugs. But sometimes the functional changes can also mean there's some changing personal care needs. If a person is having more bone and joint stiffness because of osteoarthritis, that age-related health problem, then sometimes personal care needs such as grooming and bathing, it really needs to be addressed so that further injury doesn't occur. Sometimes before people are brought into the home, family and friends can be very helpful in that regard. And bringing people into the home to support family or friends or even professionals can help with just keeping the home environment safe and clean. One of the important considerations related to function is whether or not new living arrangements need to be considered. And it's kind of known that if a person has really profound impact on function, things like getting up out of bed, transferring from the toilet to a chair, grooming, but also things like grocery shopping, keeping track of medical appointments, keeping track of medications means that new living arrangements should be considered to be helpful. So I'm talking about function, and I'd like to just close off with some notions about health promotion, because health promotion is much more than just disease prevention. Our focus is really healthy aging, not looking for that magic pill that's going to keep us young, but just how to age healthy. So I encourage you to take advantage of your Welcome to Medicare visits, which I'm assuming most of you have already had as you've started with Medicare, but also your annual wellness visit. There's excellent coverage now for some of the sort of health promotion, disease prevention, counseling kinds of activities each year. And then keep in mind that about 70% of the decline in function is modifiable through stopping smoking, improving nutrition, physical activity, preventing injuries from falls, and using preventive services. I was asked last time I gave this talk to talk a little bit about alcohol effects in older adults. So I do want to mention that even if you have been a moderate drinker all of your life and have no problem, as you get older, you are going to be more sensitive to alcohol. And in fact, older women are more sensitive than older men. So what happens is the effects of alcohol come on more quickly, and alcohol can take longer to break down, which means there's a greater risk of accidents. It also means that alcohol and medicines don't mix very well and can be quite dangerous, and that heavy drinking can sometimes make health problems much, much worse. So the recommendation for older adults is really no more than 7 drinks a week. Or if you don't drink every day, no more than 1 or 2 drinks in a day. For smoking cessation, the big lesson to be learned is you can stop smoking at any age, and it can be beneficial. It can reduce your risk for certain conditions, but you can also take advantage of many local programs and medications, and there can be insurance coverage for that. This chart just sort of shows somebody who's never smoked might have a gradual decline in lung function. Someone who smoked regularly, that decline is pretty steep. But if they stop smoking at age 45 or at age 65, the steepness of that curve, its effect on lung function, can be really diminished. Nutrition can be affected by the changes of aging. As I mentioned, sensory changes, that sense of smell can affect the taste. We can have oral and gastrointestinal changes, muscles and bones if we're having difficulty with manipulating utensils and that kind of thing. And then increased body fat can affect our nutrition. Other changes that can affect dietary intake are just because eating is such a social activity. So social isolation, being lonely, losing a partner can have a real profound impact on someone's intake. And so if you know someone who's going through that, invite them out to eat, at least when the social distancing is over. Food insecurity refers to the fact that sometimes the good food can be pretty expensive. And so it's important for people who are on a reduced or a fixed income to really have some help in thinking about healthy food intake and focusing on a healthy plate with multiple colors and emphasizing food matrix over supplements. Supplements can be pretty darn expensive, and the research just tended to show that although maybe some vitamin here or some mineral there has been shown to reduce risk of some kind of a health problem, generally when those vitamins or minerals are mixed up in food, it's much better than taking them in a supplement or a pill form. Some of the healthy benefits of physical activity refer to the fact that physical activity can be helpful regardless of other kinds of health changes. So even if you quit smoking, you're going to get even more benefit from physical activity. And this little diagram here is just to remind me to tell you that it can be quite a circular kind of situation where if we're less active, then we have more health problems, which cause us to be even less active, and it goes around and around and around. So more activity means more benefits, and the recommendation is really 3 or more days of activity each week. Walking is great, but it's ideal to include some kind of stretching, some kind of weight training or lifting things, and a focus on balance. And so you may see people endorsing and supporting Tai Chi or even dance to enhance balance. I've mentioned a couple of times concerns about falls in older adults. These can be life-threatening, but I think it's important to mention that fear of falling can really increase risk, because when we're afraid of falling, we restrict our activities, we're dependent on other people or other things to help us, and so then we get anxious when we're presented with challenges like ice, like no railings, like decreased ability to see changes in steps and that kind of thing. So if you've fallen or stumble often, you're more likely to fall, and so fall prevention is key. Keeping in your environment, being aware of your environment, having accommodations to that, and taking a look at your medications. I'm just going to mention sleep hygiene, and we're going to have to finish up here. Sorry to have gone on, but I think healthy aging and sleep hygiene go hand in hand. It's really important to get a good night's sleep. There are changes in sleep for older adults, but it's not as profound as one might think. And so some things to keep in mind is for helping with sleep is to use bed only for sleep and for sex and not for other things. If you can't sleep, get out of bed before trying to sleep again. Focus on having a restful environment, follow rituals so that you're getting yourself prepared for sleep. Try avoiding napping in the afternoon. Naps are okay, but late in the afternoon is going to affect your nighttime sleep. Avoid heavy eating, caffeine or alcohol late in the day, smoking, or even exercise late in the day. And when you're trying to sleep, try to avoid thinking about problems and issues and rehashing events of the day. So what's healthy aging? Some truths that we know about healthy aging are that it's never too late to learn things about ourselves, about our health, and just new activities. I tell students that most older adults function very well even when they have chronic illness, and it's never too late to start and benefit from lifestyle habits to pursue a goal then in our lives of not just prolonging life, but adding life to the years that we have. So these are some great websites that you might want to keep in mind, and you can, I think they're going to send you copies of these slides so that you have these links. The National Institute on Aging is a great resource for trusting, information you can trust, as well as the American Geriatric Society, which has a website for older adults and their caregivers. And so when you, someone mentioned family and friends asking about hearing, this is a place for you and them to go to learn more about it. Just to keep in mind that problems that you have can be solved if you seek some help and take some responsibility and impose some of that responsibility on your healthcare provider, and take a look at your environment, because what surrounds us shapes our health and helps to prevent problems of both the normal biological changes that get compounded if we have age-related changes as well. I mentioned I'm from Alaska, so this is a little photo that's near and dear to my heart, and just to kind of keep in mind, finding opportunities in the challenges that we have in life can have some real benefits. I don't know where we are in terms of being able to continue to have some chat, but if you have any questions and want to just send me an email, please don't hesitate to do so. Let's see, I got a question about, please speak more about thyroid changes, normal and other changes to be discussed. There are some slight changes in thyroid function, but the profound changes that we see are usually not normal. The thyroid can become a little bit more nodular, and so that sometimes combined with other issues can cause a person to have issues with either low or high thyroid. And so if you're noticing changes with cold or heat intolerance, that's something to have your thyroid function checked out by your healthcare provider. Someone mentioned that Medicare annual wellness visit doesn't cover new concerns. Is that accurate? Not necessarily. If the new concerns fall in line with issues that are involving wellness habits, that can be incorporated. But generally, new health problems need to be addressed separate from the wellness visit. And I think our healthcare providers have gotten very good at understanding the parameters for the Medicare wellness visits, so that they can kind of divide up the effort, focusing on the new problem, but also identifying new health habits to address some of those kinds of issues in the wellness visit. I hope that answers things. And I think that's it.
No, I have one more question for you, Barbara.
Uh-huh.
The question is that I didn't see you talk a little bit about, like, if you bend down and pick up something and you hurt your back and backaches, is that with aging too, or not stretching or not exercising, and then it takes 2 or 3
Well, that's a really great point, because exercising and stretching, all of that can help with those kinds of problems. Certainly, the people who are more at risk or have issues of osteoarthritis or osteoporosis can have more problems with twisting and turning and bending down and that kind of thing. But being aware of those kinds of changes, as well as then doing exercises that increase your flexibility, your stretching, and that sort of thing, can help prevent that. Balance is another issue. Knowing with sort of balance kinds of exercises, you have a better ability to adjust to some of the changes when you bend down or twist or turn that can cause some disastrous problems with pain as time goes along. And so the exercise is a great way to prevent some of that, as well as being aware of what are the age-related changes that can cause those kinds of pains, osteoarthritis and osteoporosis being two big ones.
And then there's another chat that said that they want us to send the slides, so we will be happy to send the slides to everyone, because there was a lot of information that you talked about, a lot of useful information, but then having the slides, you can take your time. And also towards the end, that's my favorite slide that said that consider new living arrangements. Here we are. So we're Aljoya, Mercer Island, and we would love to talk to you all about considering new living arrangements and work with that. But really, our job is to be informative to our potential residents, and thank you all for joining in that. And thank you, Barbara, for taking the time and speaking very clear and explaining a lot of things already. So we will.
Although also thanks to everyone for putting up with my motor mouth.
No, that was great. Oh, I see a question from Chris.
That's just a clap.
Oh, clap. Okay, good. Okay, good. Also, we will be sending a feedback form as well. Please fill it out and send it back to us, because we want to know, always trying to improve our Zoom and how we communicate to our potential residents. And then we will send the slides as well. So thank you all very much. And please email any questions. We can send them to, or here's Barbara's email right there. So you can send her an email as well. And thank you for being a part of this, everyone. And we appreciate you all joining on behalf of David and myself and Aljoya, Mercer Island.
Stay well, stay safe. We'll see you on the other side of this pandemic.
Okay, wonderful. Thank you.
All right, thank you, everyone.